Good morning, everyone. Thank you for
Morning.
joining us.
Good morning.
I'm excited to get started on this topic. This is a version of our Ask Us Anything series that Shannon does on our website or on our Instagram. And we're going to do a teen edition today to answer some questions about teen mental health and, maybe parent questions about teens or questions that teens are asking us. So before we get started, I want to introduce our co-panelists today, or my co-panelists today. So with us is Margaret Riddick, who is a therapist at Ballard High School, correct?
Mm-hmm.
And she sees students there. She's also a MFT associate and got her MS in social work and an MFT at U of L, the Kent School, correct?
Yes.
Yes, where many of our panelists are coming from. So thank you, Kent School, for really filling our panels. I appreciate it. And then Shannon Gaunter is actually a colleague of mine at Mental Health Lou. Like I said, she runs the Ask Us Anything series. You'll probably see her, throughout our website and our pages. She's awesome and active there. She is also a licensed clinical counselor, or a professional clinical counselor. Sorry about that. Who is the owner of Be Mindful Louisville and has her private practice at Therapy by Shannon. So welcome to both of you. Thank you both for joining us. Yeah. We are going to go ahead and get started with asking some of these questions. So, and we'll kind of put Maggie on the hot seat for some of them, because I think you do a lot of work with teens, right? You see teens every day.
Yes, that's my primary population.
Yes, perfect. So Shannon, do you want to go ahead and get started?
Yeah, of course. First question that kind of came in was from a teen themselves. And it seems like their main concern is, if I go see a therapist, so me as a teen going to see a therapist, are they going to make me take medication or get on some type of pill?
Mm-hmm. Yeah, I noticed that question a lot, because I think that that's a big fear for a lot of our kids, that, you're automatically going to get some sort of medication when you come in. So the simple answer to that is no, obviously, because therapists can't prescribe medication. The person that you might talk to about medication would potentially be your pediatrician, a psychiatrist, a psychiatric nurse practitioner, and sometimes even, kids or teens might be interested in that at some point. And so that's a good conversation to have with your therapist, because your therapist should be able to connect you to those providers to, look into medication if that's something that you are interested in. But typically medication, I think, is something that's kind of not a last resort, but not the first line of action when you come in to see a therapist. And so, really we're coming in to see a therapist, and then maybe down the road, if that's something that, your therapist and you as a teenager decide, well, maybe we can look into that, then it's good to kind of have that resource, and your therapist can kind of connect you to those people that would potentially be able to talk to you about that. But the simple answer to that is no.
Yeah. I like how you differentiate, though, between kind of the realm of talk therapy with kind of traditionally how we think of therapists, and then some of the kind of differentiation between a psychiatrist or a psych nurse practitioner, or someone who does do, talk therapy, but their primary role is medication management, and being able to, of course, keep the guardians and the teen involved in that conversation.
Right.
And it being an option if it needs to be, but it doesn't need to be for everyone.
Sure. Mm-hmm.
Yeah, and I really like highlighting the piece too of it's a conversation, right? Mm-hmm. It's not oh, here you are, I'm going to diagnose you with something, and there you go. And I think especially because a lot of, with our teen clients especially, is they're in transition. So what might present as anxiety or depression, is also phase of what we call phase of life. And so, yes, maybe a little anxiety medication, a little antidepressants, although there's considerations for those things, might be helpful, but it's also important to consider, is this specific to right now in life that you're feeling some anxiety? Or is this something that actually you're going to experience long term of your life? So really having a conversation about that, and a conversation about how do you even feel about medication. Like, your therapist is on your team. Your therapist isn't there to kind of force you to do anything that you're not comfortable or ready to do, or your family isn't really comfortable or ready for you to do.
Mm-hmm.
Yeah. The next question is, how do I really know that my counselor isn't sharing my business with my parents or guardians or others?
Good one, because I feel like that's a really big one, especially with teenagers and adolescents, and just that idea of confidentiality. But when you come and see a therapist as a teenager, you are the client in that aspect, and you are this is your place and your therapy, and so I really like the idea of just having that transparent conversation between each other as a therapist and the teenager, specifically regarding confidentiality and kind of what you are comfortable personally sharing with your parent. Obviously, there are some things that might have to go outside of the therapy room, or be discussed with maybe a parent or a trusted adult, someone at school. And there's three big things on that. If you're expressing that you might want to hurt yourself, expressing that you might want to hurt someone else, or someone is hurting you. And in those cases, as a therapist, our main priority is keeping our clients and our teens safe. And so those times we have to potentially go outside of the therapy room. But I love to kind of emphasize the idea of transparency in that, and talking with your therapist about, even if you do have to share something with my parent, can you let me know that you're sharing that with your parent, with my parent, and just kind of having that transparency in that regard, and just allowing, this is your therapy session. So I think that's another big piece of just being able to say to your therapist, there might be times where they do have to go outside the therapy room, and really telling them, I know that you have to do that, but would you let me know if you have to talk with my parent, and what would that look like? Or could I be in the room when you share that information with my parent, so that I'm kind of fully aware of what's being told. But outside of those three exceptions, everything else is confidential, unless that's something that you and your therapist have discussed, and you want to keep that open line of communication and conversation with a parent.
Yeah, I think it's important for people to know too, like, as you name those three, and they are important three. We want to keep you safe. We want to keep others safe. We want to make sure no harm is coming to you. At the same time, it's okay to talk about suicidal thoughts or feelings, or even to kind of say, I've had clients before say, oh, I could just kill myself. And no, here's the thing. I know what you mean by that. And I know that you're rolling your eyes and going, oh, I had this moment and I could have just killed myself. That, I know that means that you're not actively going to harm yourself or anything like that. So we aren't going to run to your parents or to the authorities or anything like that for any tiny little thing. But we are going to check in with you if we do start to feel concerned, or we do hear some things. And, a lot of us will have some thought at some moment that is kind of a suicidal thought, in the sense of, I wonder what would happen if I just, did this thing, stepped into the road, right? Does that mean you're actively suicidal? Not necessarily. So that would be something that we would explore versus immediately going, we have to tell your parents. Oh my gosh, So know that it's a safe place where you can talk about things, and we're really going to be we're a good judge. We're very well trained on how and when to break that or not break the confidentiality, but let bring a parent in or somebody else, because we want to hold your confidentiality. And we want to make sure that you feel comfortable telling us these things, telling us about your world, because I'm sure there's a lot of stuff about you that your parents don't know, and that's okay. That's what being a teen is about.
Right.
That's differentiation. So it's okay. And we're kind of like a good diary or something, almost, a good place to kind of put some of those thoughts and feelings.
Yeah, that's a good analogy for sure.
Mm-hmm.
Yeah. And just to add a little bit of what was said before, of like bringing it into the conversation, of that is part of our role, is to take all the things inside of our head and all the thoughts that are going on throughout your day and your year and your entire life, and have a safe space to talk about them. And if something is said that does bring concern to the professional's attention or anything like that, that is where we do rely on our professional knowledge, and of course reaching out to the appropriate authorities or guardians to assist you. But remembering again that like your therapist is always on your team. We're here to keep you safe and to provide a safe space for you in whatever concept and kind of constraints that needs in the moment.
Yeah. And I think it's an ongoing conversation too, between the therapist and the teen, of just letting them know, hey, I'm just checking in. This doesn't necessarily mean that I'm, calling mom or dad, but I just want to make sure you're doing okay or you're safe. And if it does get to that point, having your therapist let you know, hey, I might need to let mom and dad know about what's going on here, and what, how do you feel about that? And that's a good thing to kind of discuss with your therapist, and kind of bring that up. You can always ask, are you going to share this with mom and dad, or are you going to share this with someone, and what's that going to kind of look like? And sometimes I've done that, and the teen might be in the room with me, just so they feel like they have full transparency of what is going on, and are fully aware of kind of what's being said.
Mm-hmm. Mm-hmm. And I want to add as well that sometimes, depending on family dynamics, maybe it doesn't feel safe to share something with mom or dad, or caregiver or whatever. And in that case, we'll find other ways to kind of like help take care of you. And that might even mean like, I'm in private practice, so I'm not at a school or anything like that, but I might, if Maggie's your counselor at school, I might, ask for your permission to call her so that she knows what's going on. And then she can just kind of call you in every now and then, or check in on you throughout the day, so that you have like a team around you taking care of you and making sure you're all right. So we can even work together as clinicians to make sure you're doing okay with whatever it is you need.
Yeah, that's a good point.
Yeah. One other thing that I kind of thought about is that not even in a crisis situation or things surrounding that, but a therapist can also really help you facilitate difficult conversations with your guardians or loved ones. Because sometimes, like Amanda said, it is difficult, depending on family dynamics, to communicate things. And that if there is something that you're really struggling with internally, or you haven't quite figured out how to articulate or put words together, that's something you and your therapist can explore. And you guys can kind of all three, or therapist, child, and family, can sit down and kind of have that conversation together, to have that therapist there again as that cheerleader and as that advocate for the teen and for, mental safety.
Yeah, that's definitely a good point.
Okay, let's see. Next question we got. This is another one from a teen. And this one is kind of worried about a friend because she cuts her arms frequently, but this teen doesn't know what to do about it. And so kind of toying between the line of like not wanting to snitch on, this peer that is cutting her arms and tell the parents, but also super concerned. Like, how do we deal with this situation and of course keep everyone safe in the
Yeah, I think that is a difficult one, especially when you're in high school or you're a teenager and you might be noticing some signs and you're not really sure how to approach that or what's the best way. And so it sounds like in this instance, you've already kind of noticed that your friend might be self-harming. I think there's a variety of things that we can also notice, mood swings, being really withdrawn, isolation, feeling really overwhelmed. And so sometimes I just advise my students to kind of just share that concern with that person and say, I've noticed that you're not eating as much, or you're really really tired. Is everything okay? Are you okay? Or I noticed you haven't been yourself lately. Is there anything that I can do to help you? It makes me afraid that you're saying these things. What can I do to help you? Is there someone that I can talk to about that for you or help you with? I think particularly in the instance of self-harm and potentially even leading into suicidal thoughts, it's really important to kind of talk with your friend about potentially bringing that to someone who is probably a trusted adult. And that doesn't necessarily mean that you have to call your friend's parents right away and say, hey, look, this is happening. You could, go to a school counselor, maybe someone who runs your club in school, maybe even a teacher that you really trust, um, you know, faith-based people, if you're in a group in that sort of area. I think it's always good to just find kind of one trusted adult that you can kind of share this information, because ultimately it's really important to kind of make sure that you are keeping your friend's safety and just notifying someone, especially if it's kind of getting to that level of self-harm or even suicidal thoughts. So reaching out to someone that you trust is really important. And I think you can do that, even with your friend with you. Say, hey, let's go together and we'll just go to the school counselor and just kind of let them know what's going on. And offering that support. We always need that support. So just making sure that you're reaching out to your friend, including them on different activities that you have going on, checking in on them regularly. Those are the times, if a friend is self-harming, that they might need a lot of friends. They might need a lot of support in their life. And so just making sure that you're checking in on them, but also really notifying a trusted adult, I think, is a really big thing. And I think another thing is just kind of making sure that you're not using any judgmental or kind of dismissive language with your friend. You don't want to just say like, oh, you'll get over it, or kind of, this is just kind of a phase. These are times where you got to kind of notice these things in your friends and really kind of bring that to the table. And it starts simply with just asking them, hey, I've noticed that this is going on. Is there something that I can do to help you? Can I help you with your classes? Can I help you with some of your homework to kind of help feel like, maybe not as overwhelmed? So I think those are all kind of good questions to start with. And mainly trying to just encourage your friend, or even you, or both, going to a trusted adult that might, like I said, it doesn't necessarily have to be a parent, or feeling like you're snitching or telling on your friend. It could be something that someone that you just trust and and it might be someone in school even, or outside extracurricular activities.
Yeah. Yeah, and I think the ability to bring in that trusted adult is in the space of like, especially kind of in the therapeutic sense or with the school counselor or something like that, is that like you're not going to get in trouble if you're self-harming. Like typically what self-harming is like a maladaptive or unhelpful coping skill that you're using. And so through that therapeutic relationship or the resources that they can assist you with, it can allow you to release what's going on in a different way that is maybe a little bit more safe for you or just kind of for your future. And so being able to understand that like there's no like getting in trouble or like I don't know, sometimes people like really kind of, again, like what Amanda was saying, is like freak out and think that like self-harming means these things, and sometimes it does kind of fall on the spectrum, accompanied with suicidal thoughts, but sometimes it's just the way that we know how to release things because we haven't been taught another healthier way how to do it. And so that therapist or that other trusted adult can hopefully kind of point in that direction of trying to kind of build different skills in another area so we can release whatever's going on in a different way.
Yeah, and I love it, like, you know, the idea of, you know, don't take it on as your mission, you know, get that trusted adult or get somebody who, you know, teachers have some more training than you do in this, or therapists do, or doctors do, or, you know, so you don't have to take on the responsibility of, you know, stopping your friend from doing this, but you can be, you know, helpful and taking care of them or helping them or being a good friend. There's also, in addition to all those things, I would say there's also a good app called Calm Harm, which can be helpful to for anybody who is self-harming, because it gives you some of those alternatives that like Shannon was talking about and different ways to process. And so if you're in that moment and you're feeling like you want to cut or you want to harm yourself in some way, you can use that app as a way of decreasing some of those feelings and helping to express and get those feelings out in a way that's, you know, not going to be harmful to you. So I think it's a pretty cool app. On this topic, I know this isn't in our list of questions, but as we're talking about it, I was thinking, you know, I've had teen clients talk about being on social media of some kind and watching live feeds of people who are talking about suicide, talking about self-harm, talking about harming others, etc. And I think that's something we would be good to address, because I think if you're on the other end and you're watching this, you know, you might feel powerless as far as, what am I supposed to do? I don't know who this person is. You know, maybe you're kind of caught up in the drama of it. Like, what is this person doing? Who is this person? Maybe you believe it, maybe you don't. I don't know. But, you know, I think it's helpful to talk to teens too about that. Like, what is, again, like, we don't want to put a ton of responsibility on you because you don't necessarily know all the answers, and that's okay. But here are some things that you can do when you're in this situation. So, Maggie, do you talk with your students about this at all, or has this been a subject you all have covered?
Yes, I mean, you know, social media plays such a big role, and I think, you know, we've noticed that, you know, specifically at Ballard, but I'm sure it's everywhere across the board. And like you said, I you know, it's not necessarily as a teen and someone who might still be in high school. It's not necessarily your responsibility to kind of make sure that that person, you know, 100% is taken care of. But oftentimes, you know, us adults are not necessarily going to see that on social media. You know, you might just see that on social media, or you and your friends. And so I really just like the idea of just being really transparent and, you know, reaching out to that person and letting them know, you know, okay, here's some resources. You know, you might not be, you know, open to these right now, but I just want to let you know that I'm here for you. And, you know, have you ever thought about talking to someone that maybe isn't your parents, or maybe someone that you're not necessarily comfortable with, but a trusted adult? And I think you, as the teenager, also kind of want to notify a trusted adult, maybe in the school, I think the school itself is I might be partial to this, but I think the school is a really good way of notifying, someone outside of your parents, because there are counselors and, now therapists that are primarily in schools that will still maintain that confidentiality. And that's a big thing too. I mean, you can always come and let somebody know this information and say, I'm letting you know this information, but I kind of want to be confidential about it. I would like to remain anonymous. I don't want, everybody knowing that I said this or I told somebody about this. But yeah, social media is a really big piece right now. And so just keeping an eye on that. We have at Ballard an Instagram that's called like Bruin Positivity. And so some students will send concerning posts that they see of other students to our Instagrams, and that can remain anonymous, but that allows us to kind of pick up on those things, specifically on social media that we as adults are probably not going to see. But they can send it in there in an anonymous way, and kind of help us, figure out, who might be struggling or who might be posting these things. But yeah, social media is something that's tough, and it's hard to know. Everybody's behind a screen, and so you're not necessarily aware truly of what's going on. But really, I think, just offering that support to that person. Sometimes people don't feel, like they can go by themselves to share this information. Like, hey, I might be having suicidal thoughts or self-harming thoughts, but I'm kind of scared to let somebody else know. So, you might offer as a friend, say, hey, I'll go with you down to the counselor's office and I'll just sit with you while you tell them what's going on. And even that, as small as that seems, can be really helpful for someone who is struggling at that moment.
Yeah, and I would add too, and if this is someone you don't know, but you just see them on social media, maybe there's someone you follow, but you don't know where they live or anything like that. Almost every single version of social media has some sort of a report button that you can use that will help send that information to, Facebook or Instagram or whatever, which is the same thing, I guess. And they will help find, that person, because if, we've heard of people being like actively suicidal on live feeds and, and some of the comments, like I had a client telling me about watching one of these the other day, and some of the comments are telling people, go for it, do it. I encourage you, you're stupid, like comments like that. And other people, of course, commenting more positive things like, please do not do this, get help, etc. So you can get that mix because it's social media, it's open to so many people. So know there are report buttons. If you do know if somebody is very much going to harm themselves or they're talking about harming others, and you know where they are, then you can kind of skip the step of the report and just kind of, you can send it directly to, like you said, the school has social media, like pretty much all the authorities also have social media. And so you can send it to them and they will take care of it and they will find that person to help them, get them the help they need. So there are lots of built-in ways, and those report buttons do help.
That's a good point.
You can help take care of people in that way too, because we are seeing an uptick in that, I think, and it's it's pretty distressing, and it's also really distressing to watch if you're watching it. So,
Yeah, I was going to say, like, even if you are just watching and consuming and sometimes reporting or trying to assist, like, you yourself find someone to talk to about all of that, because being a human in this world is really tough, let alone a teenager navigating all the different transitions and social media. Like, there's lots of things going on kind of in all parts of your world. And so just finding that safe space to decompress and let some of that heavy stuff out, because it is super heavy and a lot of it is things going on maybe on social media and things that we don't have total control of because other people are saying or posting them. But if we're the consumers and we're digesting it, it kind of impacts us as well.
Sure. Yeah.
Definitely.
Yeah. And I think just, recognizing, I know we've mentioned this before, but not being able to take it on as something that's fully your responsibility. You may see this, but, you're still a teenager too. And so that's the big piece of just getting it to someone who you feel like can take care of it. Don't necessarily feel like you have to fix it or you have to save this person or you've got to, this is 100% your responsibility. Just being able to recognize that, it's important to get it to someone who can take care of it because you are still a teenager. And like you said, seeing that can be distressful in and of itself. So,
Yeah. And I know we have a couple more questions to get to, but I just thought of something too, like for parents out there too, if your teen comes to you about, seeing a friend on social media self-harming or, your child themselves are self-harming or something around those circumstances, what are some helpful kind of, quick tips or just ways for guardians to deal with all of this as well? Because they're kind of maybe getting it secondhand or, monitoring the social media usage or just all different things. Like, what are some tips for guardians?
for parents, if they receive this information.
Yeah, like if their child does choose to come to them, with some self-harming thoughts for themselves or seeing it on social media.
Like we said, specifically with self-harming, it can be something that's, a maladaptive coping skill. And so particularly with parents, I think it's really important to just kind of take that non-judgmental approach and, kind of simply ask what's going on, what is, are you struggling with something that might be causing you to do this? I'm worried about you. Is there ways that I can help you get through this? Do you feel like you need to talk with somebody just outside of me? I think it's really important that if a child is coming to you as a parent and stating these things, that's a big sign in and of itself that takes a lot of strength to come to your parent and let them know that, and a lot of bravery in some aspects to be able to say that. And so if they're, strong enough, like if they're have all the strength to be able to come and talk to a parent, which, I'm sure isn't easy by any means, being able to acknowledge that and say, like, I'm actually really proud of you that you came and told me these things, and that you were able to share that with me. I think it's a good sign of this open communication. And so working with your child to kind of say, what are some other ways that I can help you cope when you're dealing with this anxiety or you're dealing with this depression, because I want to help you. I want to make sure that you're safe. But also acknowledging that it does take a lot of strength as a child, as a teenager, to come and talk to your parent about that. It's, it's not always easy. You never know what the reaction will be.
Mm-hmm.
And so simply acknowledging that, I think, kind of goes a long way. And not necessarily taking a judgmental approach of, why are you doing this? Or, there's other ways that you could have done this, just helping them find alternative solutions. And maybe that's a starting point or a jumping off point of discussing, well, maybe we should go to a therapist and maybe we can go together and help you try to find some different coping skills. So
there's a book I recommend to a lot of my parents who have teens in this situation, and it's actually just called Helping Teens Who Cut. Mm-hmm. And like Maggie was saying, it's so important to think about the way you're communicating with your kid at this point. Because of course, if you see cuts on their arm or some sign of self-harm, most likely your reaction is going to be fear or maybe anger or something like that. And you might respond in that way. You might, find that you're yelling at them and telling them they need to stop this. And that's not really going to be a very helpful version of communication. And so this book can be helpful in that it's helping parents kind of like learn how to talk to their teen around these things, and ways to, you know, what's going to work when it comes to, you know, decreasing that behavior. Like, does that mean that we have to hide all the razors in the house? Or that if you want to shave your legs, you have to check a razor out, you know? You know, sometimes parents become really vigilant and they're like, if you have a razor while you're in the shower, I'm going to sit here on the toilet until you're done, you know? And that's, you know, that's what some people do because it works for them in the moment. But you have to also think long term, when they're 25, are you going to be in their apartment sitting there on the toilet while they're in the shower, you know, with a razor? And so pairing that, you know, pairing some of those skills of how to communicate about that, how to help your teen process why they're doing this, what are the feelings underneath that, and maybe that does mean going to therapy together or helping them find a therapist, which I think leads to our next question, which is, how do we help teens versus maybe younger children? You know, what's the difference? Is there a difference in therapists for them? Can teens see people who see adults? Like, what is, you know, how do we help them find a therapist that's a good fit for them?
Mm-hmm. Well, I think specifically with teenagers, I think it's really important to include them in the conversation and allow them to kind of weigh in on their preferences of what they want out of a therapist. You know, what are their hopes? What are their expectations? What are your concerns? Asking them what they might feel more comfortable with. Some of my students are more comfortable with working with male therapists. Some of them are more comfortable with working with females. Some might want a therapist who has, you know, specific knowledge or a specialty surrounding, you know, LGBTQ. And so I think really including them in that conversation and asking them, you know, what are your expectations in a therapist? And what are some of your concerns of coming into therapy, and how can we find that right therapist, that right fit? And it might, you know, you might not find the right one on the first try, and that's okay. You know, you want to make sure that you find someone that kind of fits your preferences, especially as a teenager, because the hope is that you're comfortable with that person, and that you know, you're included in the conversation. You know, it's hard with children. I think it makes it a little bit difficult to include them in that conversation, and to, you know, they might not necessarily have a lot of preferences as like someone who is a teenager who might have specific preferences or wanting things that, you know, they need out of a therapist. So I think that's a really big, important point when trying to find a therapist.
Mm-hmm.
Yeah.
And we have a resource guide on our Mental Health Lou page that is a great way to find a therapist, because you can kind of click who you're looking for, whether it's child, play therapy, teen, you know, so that's also, I think, a valuable way. Or even talking to friends, like, hey, I think I want to, you know, I think my child wants to see a therapist. You know, do you know anyone good? You know, I think just a referral from a friend is usually pretty good.
Yeah.
Yeah.
Most of the time, word of mouth and asking for recommendations is pretty helpful.
Yeah. I'd also say kind of when, if that teen is kind of already in relationship with a therapist, or maybe has had a session or two, and maybe you really thought you liked what you saw on their website or what your parents were telling you about them, but then you're getting in session with them and not really feeling that vibe, like, totally normal to have that conversation with your therapist too, of saying like, hey, like, I'm not really feel like you're hearing what I'm saying or listening or responding in a way that's helpful to me. And for the teenager to be able to advocate for themselves in the room. And as therapists, you know, we're trained in the professional sense to be able to deal with that. And when we are in sessions with adults do that, and we work with them. And sometimes that looks like referring that client to someone else who is a better fit, or sometimes it looks like the therapist being able to adapt their style to work with that client's needs. And so that kind of self-expression space for the teen, of course, can be towards their guardians, but also can be towards the provider too.
Yeah. Yeah, I think that is a really good point, because I've worked with a couple students who have worked with other therapists, and they didn't necessarily feel comfortable sharing that, or thought, it really wasn't their place to kind of say, I'm not feeling it, or, I'm just not feeling heard. And so I think it's important for teenagers, and really anyone, to know that that's okay if you share that with your therapist. We're, like you said, we're trained to, handle that. And, you might have to meet with a couple different therapists, or do a little consultations with a couple to find the right fit. And, that's okay to share with someone, and specifically with your therapist, or maybe if your parents, if you feel more comfortable doing that. But yeah, you might not find the right one on the first try. So to kind of recognize that, I think.
And I think too, if you're a parent and your child, your teen, is coming to you and saying, I think I'd like to see a therapist, don't freak out. It doesn't necessarily mean anything horrible or terrible, but it might mean that they have some things that they would like to process with somebody who's not you, and and that's okay, because I have kids, and I can't be their therapist, because our relationship is different. So it just doesn't necessarily work that way. But they might feel more comfortable telling another adult something, because that adult's going to be less, maybe reactionary, or have less feelings about it. And, so don't panic. It's actually really cool. And your child obviously has some great self-awareness, and you've clearly done a good enough job that they are advocating for themselves. So, help them with that. Don't panic, and, it's going to be okay.
Yeah.
Yeah.
I know that brings us into that. I think that was that last question. My teenager wants to go see a therapist.
Well, we actually got one more that was submitted.
Okay.
And this one is from a teen as well, who sees a therapist and kind of has seen a therapist previously in his life, and struggles with anxiety and depression kind of in and out throughout his childhood and teenage years, and really struggles making friends in school and kind of in community settings. What, I guess, kind of suggestions, or just kind of exploring that concept of, teens who do struggle knowingly with anxiety, or with depression, or with other things, and socializing, and kind of interacting with other teens and making friends, and all those struggles that come with that.
Yeah, I think that is a difficult one, and especially where I work, I've noticed that there is a lot of fear and hesitancy to kind of build friendships and to connect with others, knowing that, you might have anxiety, or you might have depression, or those things that can kind of affect friendships. But, I will have to say, I feel like I have noticed a shift, particularly with this generation, of just so many of these, the students that I work with seem to be so open, and can really accept if someone is struggling with anxiety, and kind of recognizing that. And almost always, either someone has had the experience themselves, or they also know someone else who's struggling with anxiety and depression. And so, that's not always the case, but I've noticed, I think in this generation particularly, the idea of just kind of being so open with each other, and kind of recognizing that. But I think it's also important to kind of find your niche, or something that you feel very comfortable being present in, maybe that's a specific group or a club. And you don't have to go out and make 100 friends, but if you can find a good group of people or a good club that maybe sparks your interest, where people have similar ideas and thoughts about life, that can be really helpful. Sometimes that's scary to do as someone who specifically struggles with anxiety. So just really being open to that, I think. And even if you find, one friend who you feel like you can share that with, maybe that friend can come with you to do some of those extracurricular activities, or joining a club, or doing different things like that. I think it's, you can also always ask your therapist, is there a group or is there a therapy group that maybe is just for teens that struggle with anxiety or struggle with depression, and can I go to this group and maybe just see, okay, I see that other people are dealing with this too, so I'm not alone in that. I think that can always be helpful.
Yeah, I like the idea of normalized. Like, you might notice that if you're willing to maybe tell a friend, like, oh, even if you just tell them a tiny bit, like, oh, that, sometimes that makes me anxious. You might find, or you probably will find, that they'll go, oh my gosh, me too.
Right.
Because I think you're right. Teenagers today are so much more emotionally intelligent than they were even when I was a teen, and especially when my parents were teens. And they're so much more willing to be supportive and to connect with each other and support each other. And your school probably, like you said, you have that Instagram account. Like, there's probably already built into your school groups and clubs that are all about acceptance and want you to join. And maybe that part of that process is talking with a therapist or an adult or even another friend to say, I really want to do this, but I have a ton of social anxiety. Like, will you go with me? Or,
Right.
But baby steps. You just break it into tiny pieces. It's totally doable. So,
Yeah, I think that's a good idea.
Yeah. Well, thank you so much for joining us today, Maggie. We really appreciate it, and we appreciate all the work you're doing over at Ballard. I know you're hustling over there to keep everybody sane, so we appreciate that. Is there anything, this would be more for the Ballard folk, but anything you want us to know or you want to share about, like, upcoming things, or even maybe some good advice for any parents of teens who are looking to, for mental health advice or info?
Yeah, I think just always, I think NAMI is a really great resource, particularly for teens and parents, the National Alliance of Mental Illness. And I think that's a really good resource to kind of look into. We've worked a lot at Ballard with the Pete Foundation, that's local here, that does a lot of mental health awareness. So I think that's a good one to keep in mind. At Ballard specifically, we're still going to try and do our mental health month like we did last year. So
Awesome.
I'm looking forward to that. But yeah, I mean, and you can always go to Psychology Today to try to look and see if you can find a therapist. I'm partial to AAMFT website because you can find some LMFTs there as well. But, I think as a parent specifically, always reach out, I think, to your school or your school counselor. If your school has a mental health practitioner, which is what I do, I think those are all really good resources to kind of, just get started. Particularly counselors have a lot of resources and can kind of refer you in one direction or the other. And so I think that's a good starting point.
Yes, and we're always happy to, even if you don't come to us, and to see us, and we're always happy to send out resources. And so I think that's important too. And and I would add, Mental Health Lou has a lot of resources, and we'll have all of our videos. So the video from today will be posted on our website, and people can watch that again if they'd like to kind of get a recap. And we'll also have an audio version available probably next week on the Santa Mind app, which means you can listen and stop staring at screens, because I'm sure you're tired of that. So, all right. Well, thank you very much. And thank you, Shannon, for joining us as well. We appreciate it.
Thanks.
All right. Have a good day, everyone.
Thank you. You as
Thanks.
well.